Good afternoon and welcome to the Seminole County COVID update and our economic update here for July 7th, 2020. I'm Chairman Jay Zembower. We're continuing to give the community an update of what's going on two fronts. That will be the health front as well as the economic front. We continue to thank our public for being very, very sensitive and vigilant on ensuring that they're doing the right things as they travel through our community and as this COVID numbers begin to increase, as well as our hospitalizations continue to increase. We thank everybody from the business perspective who are doing all the right things and trying to do the right things. We want to remind everyone, if you have a question, especially businesses, we continue to get calls from businesses about, we're not sure what we should be doing, what do we do about this? Simply pick up the phone. We can get you the help. Just call us at 407-665-0000. The public also can call that number if you have a particular question that you have about what you should be doing or what may be going on or best practices, et cetera, et cetera. As you've heard me talk many times about the economic impacts, one thing that, I've talked to a lot of businesses this past week, and, there's a lot of discussion and maybe some disagreement on wearing masks, not wearing masks, who's getting infected, who's not getting infected, whether people are dying or not dying. And here's the reality. For a lot of the young people, maybe you're not getting as sick, maybe you're asymptomatic, but here's the economic impact of that. When you become positive as a young person, and now you're in the workplace, and your employer now understands that you're now a positive case, and maybe you've interacted with other employees, now those employees are being asked to leave the workplace. That impedes and impacts the ability of that business to perform business because they just don't have the staff to continue. And I think that's something that, I really never thought about until talking to some of these businesses who have said, Jay, look, we're open, but, we're seeing infections in our employees that maybe are not happening here, but they're bringing it on the job. And now we have to cut loose 1, 2, 3, or 4 of our key staff, which impacts our ability to perform our function, even in cases where they're operating at a reduced capacity. So I tell you that to have a clear understanding that all the prongs of the impact maybe we haven't all thought about. And we're going to hear a little more about that from our health officials today. Dr. Husty's here, Donna Walsh from the Florida Department of Health, and Mr. Alan Harris will be up here to talk about that. I want to talk a little bit about, you've heard us talk about the grant program. Seminole County's received $20.8 million of CARE funding initially. We have access to another $61 million. That will not be coming until we provide a matrix and a direct nexus to get that $61 million. That CARES Act money will be utilized to make all the 7 cities as well as the county whole and the direct cost of the COVID impact. It will not and cannot be used to supplement revenue shortfalls. So as far as budgetary issues, it will not be used for that. So all cities and counties will continue to see budget impacts from this economy downturn. Our goal, of course, is to get the economy back up and going. In order to do that, the County Commission this coming Tuesday will receive a program from our staff who have been out talking to the general business community as well as the chambers of commerce on what businesses actually are in most need of. So we already know that we've taken about 1,257 applications under our initial grant program. There are many of those that made that application that never were eligible because the money was already extended. Some weren't eligible for other reasons. That will be reopening with additional funding to come. And we'll roll that out somewhere around the middle of this month. And the commission has given direct guidance to our staff that it needs to happen sooner rather than later. The issues are businesses have been hurting, continue to hurt. Also, some of the CARES Act money will be used for helping some of our nonprofits, some of those nonprofits that have traditionally and during this pandemic have also helped with the citizens and the community itself. Those folks have taken a huge impact as well. So some of the CARES money will be utilized for that. We also will be doing some marketing to help bring business back and help people understand what they need to do to be safe and the businesses need to do to make the public feel safe so their business will be able to continue to operate. We also will be developing a website portion on our existing website here at the county, which will help businesses weigh in on and consumers weigh in on of what their experiences have been at businesses. And so when the public wants to know, where can I go have a meal, where can I go shop, and what has been the experiences, then the general public will have a resource to go see that. So those are the kind of things we're working on. So with that said, I'm going to turn it over to Mr. Alan Harris, our Emergency Management Director, which will go and talk a little about our numbers today. Thank you very much.
Thank you, Chairman. Thank you, everyone, for being here today. We wanted to talk about some of the services we are providing, and I know I've talked about this in the past. The first thing, when this started, we started to call individuals that were positive with COVID and individuals that are isolated and quarantined in the home to see what type of services they need so they could stay in their home, so they didn't have to go break isolation and quarantine to go to the grocery store, get medications and things like that. I've talked about that a few times when I've been up here, and I wanted to let you know that that service is continuing. Because of the number of cases we currently have, there is a need for some support through our nonprofit organizations that are providing this food and this service to individuals inside of their home. I want to thank Harvest Time International, Meals on Wheels, and the Sharing Center. All three of these nonprofit facilities have been providing food services as well as other support to individuals that are isolated and quarantined in their homes. We are continuing to provide this service, and this service has certainly increased over the last few weeks as more and more people are isolating and quarantining in their home. Another service we've been providing in the EOC is we have been housing homeless, first responders, healthcare workers, which are COVID positive. These individuals are housed in a facility similar to a hotel room, and they're provided basic services while they are COVID positive, either for the first responder and healthcare community to protect their families, or in the case of homeless, of course, to prevent the spread of the virus in our community. We're continuing to deliver PPE, personal protective equipment, to ALFs and nursing homes. The supply lines have started to rebound, so we're starting to get in the gowns, the masks, and things like that that we need to support those agencies on the front line of this pandemic. I am sad to say that we do have some facilities, ALF and nursing homes, that do have patients inside of them. Right now, we have 77 patients in assisted living facilities and nursing homes, 19 facilities. What's being done in those facilities, once we identify a patient, a resident that has COVID inside one of those patients, we make sure that we link up with the Florida Department of Health and special infectious disease personnel to go in and do training, assessments, and additional testing of residents and staff. As also part of an ACA rule and Florida rule, we are testing staff every other week. So every other week, ALFs and nursing homes are testing their staff to make sure that they are doing what they can to prevent the spread of any virus. Some of those patients from ALF and nursing homes have gone to hospitals. Our current hospital count in the 4 hospitals in Seminole County is 203. That is not an indication of all Seminole County residents, as some Seminole County residents have gone to Orange County hospitals like the VA hospital, Advent Health Orlando, Orlando Regional Medical Center, and other facilities. But 203 for the 4 hospitals here in Seminole County. There has been a question about ICU beds, and currently the ICU beds in Seminole County are very, very close to full, but that doesn't necessarily mean it's all COVID patients. There are some COVID patients, certainly that is an addition to the normal patients, so it does add into the ICU numbers, but it isn't total COVID patients that are taking up all the ICU beds, and I think that's important. We have been working with all 4 hospitals, and all 4 hospitals have been working on moving patients around to make sure that ICU beds are available. The hospitals have asked us to push out on our press release today, our press conference, to please not go to the emergency room for testing. So please don't go to an emergency room to get a COVID test unless you are symptomatic and you are experiencing symptoms that would necessitate you going into a hospital. And in that case, of course, you can go to an emergency room. For your access, we've been doing pop-up sites throughout our community. We did have an issue last week with some of the test kits. There was a supply line issue in the state of Florida with test kits. That continues to be an issue, but we were able to work that out for this week. So we have a testing site every day this week, Monday through Saturday. We also have testing sites that are being put on by the Florida Department of Health, as well as True Health, which is our nonprofit medical provider here in Seminole County that's been doing testing with us. All of those are located on prepareseminole.org, and all of those are registration required. So please go online and you can register right there. Or you can call our Citizens Information Hotline at 407-665-0000 to register. With that, I'd like to turn it over to Donna Walsh, Health Officer for the Florida Department of Health.
Thank you, Alan. Good afternoon. Just as every week, I would like to update everyone on the numbers of cases that have been reported in the state of Florida as of 11:30's report this morning. So to date, 213,794 cases of coronavirus in the state of Florida, with unfortunately 3,841 deaths. Here in Seminole County, we have grown exponentially. We continue to grow in cases. That we're at 3,522 confirmed coronavirus cases as of this morning. And unfortunately, again, 20 deaths. We had 3 deaths reported to us last week. Our positivity rate, as was mentioned, the testing is available every day, Sunday through Saturday now, basically, or Monday through Saturday, I should say, throughout the county in the community pop-up testing, whether that's through the Florida Department of Health. We are providing community testing Monday through Friday by appointment. We do have Saturday community pop-up test available. Our community partners, True Health and Allied Health, have been assisting along with the county in providing those services. They are by appointment, so please call to make those appointments or go to the prepareseminole.org website to see the links. You can call the Citizens Information Line, which previously mentioned, 407-665-0000 for further information. In Seminole County, we were, as back in May, at a 2.2% positivity rate for the number of people testing positive who have been tested overall. Today, we are at 8.3% positivity rate, so that is climbing as well. So far in Seminole County, we've tested almost 43,000 people. We do encourage you to continue to be tested, especially folks who have been informed that they're contacts to cases, or if you have symptoms of coronavirus, certainly seek medical attention, get tested. What I would like to mention to you today, just so that you understand the exponential growth here in Seminole County, we had been averaging 0 to 5 cases a day in May. From March through May, when this outbreak first started in March, through May, we had reported here in Seminole County 636 cases. That's in a 3-month period. And just 2.5 weeks later, June 19th, we had doubled those cases, 1,285. And by the end of June, just 1 month after that first 3 months initial outbreak, we were up to 2,772 cases. Just in the month of July alone, and that's the last 7 days, we've had reported to us 793 cases. So as you can see, this virus is very infectious. It can spread from person to person pretty readily. And with taking the appropriate precautions, we can stop the spread, as we've been mentioning every time we meet. Before you today, it's not the graph of the exponential growth. I think that everybody understands that the growth of cases as well as the hospitalizations are on an upward curve. What I would like to ask is for your help. As we're getting these numbers of cases reported to us, and as we're trying to recruit resources to do our case investigations and contact tracing, we also need for all of you to take personal responsibility. As you're getting tested at these community test sites, you're provided with an application or an app, LabCorp, Quest, that you can go in and check your own test results. If you don't hear from us with a positive or negative test result, you can find out for yourself whether or not you're positive or negative. If you are positive, you should be isolating at home for at least 10 days because you're infectious. Whether you're asymptomatic or symptomatic, you're considered infectious. You also need to monitor your signs and symptoms. If your symptoms get worse, please go to the hospital and get checked. Call your doctor's office. Make sure that you're taking care of yourself. The 6 feet distancing at home while you're isolating, you need to practice that so that you protect your family, your friends, and your neighbors. You also need to notify anybody that you may have been in close contact with 48 hours before your symptoms started through the time that you had contact with that individual. Or if you're asymptomatic, 48 hours before your test results came back, or that you got tested, I should say, 48 hours before you got tested, and make sure those people are aware that they could have potentially been exposed to you and you have COVID. Those people, your close contacts, should be in quarantine for 14 days. The incubation period for COVID or coronavirus is 2 to 14 days. I know it was mentioned that if you expose somebody in the workplace, that those people should be in quarantine for 14 days because there is the likelihood that they're going to spread that in the workplace if they become infectious during the time of that incubation period. So we need your help. We will be in contact with you. Of course, our county has been extremely supportive of public health investigations. They contact every other day everyone that we know of that is COVID positive or contacts to make sure that your needs are being met as you're isolating at home. So if you do need food, if you do need housing, if you need medication, pet care, all of those needs are taken care of through county services. So essentially, if you have any questions whatsoever, please don't hesitate to call the Florida Department of Health, 407-665-3000, option 1, or the Citizens Information Line, 407-665-0000. And you can also go to our dashboard, floridahealthcovid19.gov, and prepareseminole.org for more information. Thank you for your cooperation and your help to keep your neighbors, your friends, your family safe. And with that, I'll introduce you to Dr. Todd Husty, our County Medical Director.
First thing I'm going to do, wipe down the environmental surfaces. Good afternoon. I've been here before. You've probably seen me if you've watched any of these. You know that my message probably has not changed at all since I started doing this. Excuse me, my mask is slipping, which is not good. So one of the things that has changed is my relationship with our hospitals and talking with them about their concerns about what's going on in the community. All I can tell you is they went from concerned to very very, very concerned. I mean, that's over the last 3 weeks. So they're seriously worried about what's going to happen to us and what's going to happen. Especially, we're nervous about what we're going to see after 10, 14 days after the July 4th weekend. We all know that there were a lot of gatherings. Gatherings spread this disease, and we're going to have a problem, more than likely. On the other hand, is that through the help of the media, and I really mean that, through the help of the media and other efforts that we've taken to get this education out to all of you about what can we do to stop this darn thing. What can we do? And the answer is, well, you know the answer. Excuse me, I'm having a problem with this today. The answer is obviously facial coverings, social distancing, and wash, wash, wash. Some of you are not convinced that facial coverings work. I am purely just a doctor. I'm just an ER doc. But I've done my homework. I've researched and researched and researched. There's a new study out that came out yesterday from Great Britain that says absolutely facial coverings work. Well, that's the same as I found in my research over and over and over again. is that facial coverings can work to stop the spread of this respiratory virus. No two ways about it. It shouldn't be questioned at this point. I know that some of you don't feel that way. I'm sorry, but the reason behind this and the science behind this is that it does work. But let me phrase it a different way. I've had multiple calls, as Chairman Zembower said, he has too, from businesses wondering what to do because they have a COVID positive worker. What do we do? What are we supposed to do? And I got a call from a guy that owns a fairly big shop and has quite a few employees. One of their employees became positive. My first question always is everybody wearing facial covering? Because that changes the level of exposure that you have. If one person comes positive and everybody does social distancing and wears facial coverings, the level of exposure is lower than if they don't. Unfortunately, this one business owner has a big warehouse, and it's hot back there. And they probably aren't as diligent, they weren't as diligent about wearing their facial coverings. Ask them now. They're now all wearing facial covering because now they get it. Now they understand the importance of not spreading this disease to themselves, from other people, or to other people. I've had a number of instances of this. And you ask somebody who has a child, I know quite a few, who have COVID and live at home. Ask them if they wear facial covering every time they're anywhere near each other. Of course they do. I mean, everybody does that once you're that close to it. Once it's knocked on your door, you'll wear a mask. Before then, I guess you have the right to decide for yourself, but please try to see the reason. I actually would ask you to assume for a while that it works. Just assume. Work with us for just a little while. Just wear these things. Social distance. Do all the things we're supposed to do. And let's see if that can have a good impact on this virus. One last thing that I probably need to address is that, and if you're young, if you think that only people that have bad immune systems or are old can get this, we've had 30-year-olds. Yeah, obesity is big in our country. Obesity it's worse when you have COVID and you're obese, or if you have undiagnosed diabetes. So there are other conditions that even our young people, we've had deaths in the 30-year-old group. So please assume for a while that they work, do the right things, and thank you. Chairman Zembower?
Thank you, Dr. Husty. And with that, we'll take any questions from the media for any of the speakers we had here today.
Doc, I know you were just up there, but if you could step back. How worried should we be about hospitalizations over 200?
We should be very worried. It's the hospitals are having a hard time staffing. I mean, if you think about it, every single patient that they see that has COVID takes twice as long as the ones that don't have COVID. So the more hospitalizations we have with COVID, the more it taxes their resources of staff, including housekeeping. How long does it take to clean a room usually? Every room now has to be cleaned, just exquisitely. It takes people longer to do it. So everything, the staffing issue is huge.
At a 30% increase in hospitalizations on the 7th of July, and I believe your supposition is we probably had quite a bit of exposure to one another on the 3rd and 4th. Increase in hospitalizations, increase in people gathering, the community spread. Should we wonder where we're going to be 5 days from now?
I think at least 7 to 10 to 14 days from now, we are going to really see it. Remember, the people will start getting it 7 days from now, but they'll get sick enough to be in hospitals probably another 7 days after that. So it's somewhere between a week to 14 to 3 week lag period. And that's what we really saw after Memorial Day. We're seeing a whole bunch of people that are in the hospital now.
And not to dominate the conversation, but I do want to make this point. Are the cattle out of the barn, or if we really are diligent about mask, hand washing, and social distancing, even can we limit the exposures that may have already occurred from spreading more?
Absolutely. We can limit the exposures from spreading more. If you look at the actual percentage of the population that has this, there are a whole bunch of people that are still naive to this virus. They're naive, meaning that we don't have any immunity to it at all. So there's still a lot of people it could spread to and get a whole bunch more worse. Instead, if we do everything right, if we just get it to level out, it'll start falling off on its own. So we have to stop spreading one person to one person or one person to two, because that lets it grow. If we can spread one person to a half of a person, it takes two people to infect somebody, we can make the numbers come down. We can really make the numbers come down. By the way, I was on the state call with all the EMS medical directors in the state. It was sobering what's happening in some of the other communities where this has gotten out of control. I mean, we're pretty close to out of control. They're absolutely out of control. It can get worse before it gets better.
A question for Donna. I wanted to ask about the schools. I know the Department of Health has been working with the schools on their plans. With the governor and the Secretary of Education announcing that the schools will be open 5 days a week, does that impact what you guys are doing with your plans for the schools here in Seminole County? I know the school district still has to vote on their plan on the 14th.
Sure. We have been working very closely with the superintendent and his team. There are a couple of different models out there that have been approved for schools to utilize. Whether, and I'm really speaking out of turn here because I don't represent the Department of Education, but there were several different models where students can either opt into virtual school or similar to what happened with the last several months of school, where they're, working from home. There's the rotating classroom half sizes. So we're taking all of that into consideration to minimize close contact within a school system. Maintaining a classroom of students within that same classroom all day, especially in your elementary level classrooms. So a number of models have been discussed. I think the school has thought of, very thoroughly has thought of just about every scenario, and I commend them for their plan. It's extraordinary. But we will continue to work very closely with them, of course, following the guidance that's out there to minimize the spread of this. And of course, not only to student, but students to staff, including your professional teachers and your other staff within a school system. They've even gotten down to the bus routes and how many sitting on assigned seats on the bus, for instance, and the food delivery during the school day and so forth. So they've pretty much thought of everything. They've done an extraordinary job.
I admittedly didn't read the executive order that thoroughly, but I did skim it. The way I read it, and correct me if my information is correct, they said they wanted kids in class 5 days a week by the fall, unless the Department of Health thought in a specific region that they should intervene. If that's the case, what would it take for you to intervene and say, hey, maybe we shouldn't be sending kids into the classroom this fall?
Right. Well, honestly, consultation. We're in communication with the superintendent and his team all the time. He doesn't have a problem picking up the phone, and neither do I, talking with each other. Constant communication on where we are with our numbers of cases within our county. Is it safe for students and staff to return to the school setting? If the mandate is that the schools stay open 5 days a week, we can certainly tailor that down to minimize exposure. But there will be a number of factors to consider, no doubt.
But as we sit here today, you think it can happen with the right restrictions?
With the correct restrictions.
Jay? There's, as you know, a group that is against the mask order. There's a protest today in Altamont. The leader, one of the leaders of this group, is talking about, on his Facebook page, asking people to go against, or those that you spotlight on the county's webpage, to not visit those businesses because they are wearing masks. This guy also does business with the county. He has a contract with the county, my understanding. I also understand that the county did a video on him in his business. So should somebody who had a video like this done on him is now telling people to ban against businesses that are being COVID responsible? What is your thoughts on that?
Well, my initial thought is quite ironic. But the reality is, and as you saw me greet this group of people last week in Sanford, they're part of our community. They have the right and deserve to be heard. They have the right and deserve to assemble peacefully. And that's what our country is founded on, expressing our opinions. Now, in the immediate case, what I would say is, look, we need to do the right thing. We need to do the right thing for our community. And I get the fact you don't want to wear a seatbelt, you don't want to wear a mask, you don't want to obey the speed limit. I get all that. At the end of the day, not thinking about yourself, you've got to think about the other people in the community. And, when I have elderly individuals who are calling my office and saying, we know that we could be impacted by this virus, but we've got to get out of the house. But we don't feel safe going out of the house because we see people running around not social distancing and not doing the things that we would feel safe interacting with us. So, I would say, and I've said before, this is not about whether you are a Republican, whether you're a Democratic, whether you're an NPA, a Libertarian. This virus doesn't care. It's non-discriminative. And it amazes me that people don't take things serious. I think we've seen that with other things. But, I would only ask and urge those individuals, peaceably assemble, do what you think you want to do to express your opinions, and try to protect the rest of the people around you. I mean, that's really the message. And I think we've heard the doctors, the hospitals, everybody has said, what we do know is social distancing, masking, washing our hands, all those things help. Coming together in big crowds, not so much. So, I think our general public, to the topic of, if it's a contractor doing business with the county that's not, conducting themselves in a fashion or manner, I think the general public will voice their opinion. I mean, I think our public's been very vocal on a number of items. So, to that point, and getting back to the school issue, I very much want to thank Dr. Griffin and the school board, who's done a fantastic job with the schools. They really have. I've sat in on those conversations, and that's what our community needs to understand. What is very, very unique about our community is everybody's talking. It's not like the school board's off on their own trying to figure out what they're going to do and how they're going to do it. They're talking to people throughout the region and other school systems. They're talking to the healthcare professionals here. They're talking to emergency management. So the same thing goes back and forth in this dialogue and understanding what's really best for the community, and that includes input from the general public, which we all as commissioners receive on a daily basis, either phone calls or emails and so forth. So I just want to assure the public that the group of people here at the EOC and the executive group are in constant contact and truly looking out for the safety and welfare of 470,000 people, not just a handful.
And Jay, for the people who are listening in, isn't it also an important distinction that where the virus is different from other things is that if I don't wear my seatbelt, I go through the windshield, but if I don't wear a mask, maybe my neighbor goes through my windshield?
Well, absolutely, to that point, absolutely. And we've heard the doctors and all the healthcare professionals say, you may feel great, you're asymptomatic, you're living your life, nothing's wrong, you're going to work, but you're spreading it through the community. And you say, well, I don't come in contact with the elderly. Well, maybe you gave it to a fellow young person who then did come in contact with the elderly. And what we're hearing is, with colleges starting back up, and I just saw the numbers in my office, and it was actually an economic driver, but it brings up another point, which is rents are falling and people are leaving the rental community, and a vast majority of these are college students who are now, for the first time, moving back home with mom and dad. So now we have the college students moving in with mom and dad, which many are elderly, which then begs the question is, like Dr. Husty indicated, what did we all do when we were youngsters? And is masking the right thing to even do in the same household? And I think to Dr. Husty's point is, with more and more of these younger people not going to college, because some of the colleges are going to be held virtually, or they don't want to be in that setting, they're now moving back home with mom and dad or grandparents in many cases. So I would just ask the public to do what's right. Everybody knows and can take responsibility for doing what's right by your fellow citizen.
Chairman, we have another question from Rosner Jean-Pierre of Radio Haiti. He's asking what your evaluation is of residents in the county after the mask order was issued. Have they been compliant? Have you seen a lot more mask use?
Sure. So, leading up to that is we have some of a benefit here in Seminole County, because if you look at the statistics through the years, Seminole County has been in the top 5 healthiest counties in the state of Florida for years. That's the first benefit we have with any type of issue that would affect our health. Secondary to that, our people are very astute for the most part, very well educated, and for the most part take personal responsibility in doing what's right by themselves, their businesses, and the fellows in the community. We did see an increase in more masking once the order went out, in the mandatory order, that people, were taking it seriously. And I don't always understand or try to understand why, it's government's job to have to tell people to do things. But apparently, yes, it did make a difference with the amount of people wearing masks. So absolutely.
I have a question about ICU beds. I don't know who's best.
That's probably for one of the doctors or
Okay.
EOC.
What happens if we reach 100% capacity? Is there a plan to expand?
Yes, what happens if we reach 100% capacity is the question in ICUs and hospitals. The hospitals have more ways to take care of patients other than in regular beds. There are a number of things that they could do. They have contingency plans. I mean, they range everywhere from tents outside, which we had at the beginning of this, and then we dismantled the tents because we didn't need them. Whoops, maybe we need them again. So I know that I talk with all the CEOs of our hospitals on a regular basis, and they all have contingency plans for stepwise approaches. Right now they haven't really decreased the amount of elective surgeries. That's on the table, is decreasing them in a stepwise approach to have more beds available. But alternative sites, we have a number of places that could probably be used as an alternative site. Some of our freestanding emergency centers have CAT scans and laboratories, etc. So they could actually be stood up. So there are still a variety of ways, and the hospitals all have contingency plans. There is a point, though, where the best contingency plan still won't work. We do not want to be New York, and we do not want to be Houston.
If there are no other questions, we will turn it over for Freddie Gonzalez to do our Hispanic translation. Thank you, Freddie, and thank you, media, for being here with us today.
Buenas tardes, este es el resumen en español para la conferencia de prensa hoy, el 7 de julio del 2020. Empezó hablando el presidente de la Junta de Comisionados del Condado, Jay Zembower, hablando de los fondos del CARES Act que el Condado de Seminole ha recibido la semana pasada, que fue un 25% del total de lo que va el Condado a recibir. Ese total es 20.5 millones. En el 14 de julio, la semana que viene, va a ser una reunión de discutir cómo van a usar ese dinero para ayudar al condado de lo que fueron afectados por el virus de estos últimos meses. Algunos de los planes es dar más dinero al fondo que está ayudando a los negocios. Otros planes son para hacer un programa de ayudar a los residentes que fueron afectados del virus. También otro plan es hacer un programa para ayudar a las organizaciones sin ánimo de lucro y diferentes otras opciones que lo van a discutir la semana que viene. También están buscando esos negocios que recibieron el fondo el CARES Funding que ayudó a esos negocios de lo que fue afectado del virus y quieren saber cómo les salieron, cómo le pueden ayudar y ganar más ideas cómo pueden usar ese dinero a ayudar al resto de la comunidad. El otro 75% del dinero, que es 61 millones, va a ser más dedicado para reembolso, para cualquier cosa que fue gastado o fue usado en este tiempo, esta época, que es ayudando y dedicado para lo que fueron afectados del virus. Otra cosa, mencionó él que van a tener una página de internet que están haciendo, que los negocios pueden poner su propia información en poniendo lo que está haciendo para tener más protección y más seguridad del virus, y qué son las precauciones que esos negocios están usando, y el público puede dar su opinión y puede dar sus comentarios, cómo pasaron las experiencias en esos negocios, y cuando uno quiere salir a comer o de compras puede mirar ese sitio de la página y asegurar cuáles son los mejores negocios de ir que tienen más protección disponible. Después vino el director de manejo de emergencias, Alan Harris, que empezó hablando de comenzar eso del virus. El condado ha ayudado a los que están en cuarentena con el virus confirmado, que no tienen ninguna otra opción de comida o hacer compras, que el condado lo está dando esa asistencia y ayudándolos. Y lo están llamando a esas personas cada 2 a 3 días. También le quiero agradecer a esas organizaciones sin ánimo de lucro, como el Harvest Time, el Meals on Wheels y el Sharing Center, que lo ha ayudado mucho en estos últimos meses en ese proceso. También él mencionó que el equipo de protección personal, como guantes, desinfectantes y mascarillas, están llegando más constantemente al condado. En los últimos meses había un poco de atraso en las órdenes de esas cosas, pero parece que las órdenes están llegando más seguido y está llegando más organizado. Ha mencionado que en las casas de salud o casas de rehabilitación, los empleados están tomando el examen cada 2 semanas, asegurar que no sean positivos y que salga negativo. Cada 2 semanas todos los empleados por el condado de Seminole que están en esos lugares. Desafortunadamente, lo que están en el hospital, en los 4 hospitales que tenemos, hay 203 personas, y mencionó que los cuartos que es dedicado para personas bajo de intensivo está casi a capacidad. También mencionó que los hospitales están pidiendo que si quieren tomar un examen del virus, por favor no vayan al cuarto de emergencia de los hospitales, porque esos son dedicados para otras cosas. También esta semana que estamos de lunes a sábado, todos los días tenemos un sitio diferente para hacer las pruebas. Todos los sitios se requiere cita. Y para asegurarse de una cita, pueden ir a nuestra página de internet en prepareseminole.org o llamen al número 407-665-0000. Después vino también la directora del Departamento de Salud, Donna Walsh, que mencionó hasta hoy, el 7 de julio, de 11:30 de la mañana, el estado de la Florida ha tenido 213,000 casos positivos y 3,841 muertos. En el condado de Seminole ha habido 3,522 casos confirmados y desafortunadamente 20 muertos. En el pasado, el tasa de positividad era un 2.2%, pero desafortunadamente ha subido a un 8.3%. Vemos que había un aumento en los casos y siguen aumentando. En el mes de mayo, a diario teníamos 0 a 5 personas cada día, y ahora estamos viendo que todos los días estamos recibiendo 100 a 200 personas que tienen el virus. Desde marzo hasta mayo, en esos meses, ha habido 636 casos. Pero desde el 19 de junio a finales de junio, el total ha habido 2,772 casos en esa época de unos 10 días. En el mes de julio solo, hasta este momento, ha recibido 793 casos. Esto requiere que cada uno tenemos que hacer nuestra parte y estar seguro que estamos haciendo las recomendaciones y tomando nuestra precaución de nuestro distanciamiento social, también usando mascarilla y lavándose las manos frecuentemente. Mencionó que si si saliste positivo del examen, los primeros días que te sentías los síntomas, que contacte a las personas que estabas cercano para dejarles saber que estás positivo y en ese tiempo estabas sintiendo síntomas. También a las personas que están positivos pero no tienen síntomas, que contacten a las personas que estaban alrededor unos 48 horas antes de tomar su examen. Y por favor, los que estaban alrededor de una persona que tiene virus, que pueden chequearse y tratar de estar aislado por 14 días. Y si se pone peor, que llamen o visiten a un hospital. También en nuestro centro de operaciones de emergencia estamos llamando a esas personas que están de cuarentena cada 2 a 3 días a chequeando si tienen alguna necesidad, si necesitan una medicación o cualquier otra necesidad en general. Si tienen alguna pregunta o necesidad pueden llamar a nuestro número al 407-665-0000 o para el Departamento de Salud pueden llamar al 407-665-3000 y opción 1. Y finalmente me habló el director médico del condado de Seminole, el doctor Todd Husty. Él mencionó que estaba últimamente más conversación con los hospitales en la área y mencionó que los hospitales están teniendo más precaución porque ven que los casos están subiendo y tienen el ojo puesto después de este fin de semana del 4 de julio en los próximos 12 a 14 días cómo los números se van a cambiar. Él mencionó que las máscaras trabajan, la ciencia y los doctores de diferentes lugares lo han probado y enseña que usando la mascarilla es bien importante y hace un efecto positivo al virus. También había una pregunta que si hay un negocio que tiene un empleado que salió positivo, siempre hay que preguntarse y asegurar que todos los empleados en el negocio tenían una máscara puesta en todo el tiempo, porque eso puede ser un cambio bien grande en ayudando a parar este virus. Si necesita una cita para uno de los sitios de pruebas o si tiene una pregunta o necesita más información de lo que el condado está haciendo, pueden visitar nuestra página de internet en prepareseminole.org, que es prepareseminole.org, o también, como mencioné antes, pueden llamar al número 407-665-0000. Gracias.